December 2022. And this we cannot achieve without conducting the regular COVID-19 vaccination. And it has become a tradition. Anytime we are set for this vaccination campaign, we'll call our colleagues, the media personnel, because we believe you are very key in ensuring for us to attain our target. So this is why often we talk to you because of the important role you play in ensuring the information, the right information, is reached to the intended target. On that note, I welcome all of you to this press briefing, and we hope our collaboration in the fight against COVID-19 will be more and more strengthened. And we really appreciate your time, that anytime we've called, you'll always come to answer to our call. This shows that we are in this together. And for the Gambia to achieve this 70% target as of 31st December 2022, media has a critical role to play. On that note, I will allow the Deputy Program Manager, the Deputy Director, Directorate of Health Promotion and Education, to give a brief statement. Director Sanjal, you are welcome.
Because we cannot push all these things up. Thank you very much, Mr. Mamandin. And good morning to you all. Thank you, Siddharth, Aja, and colleague. Thank you very much for having this team with us once again. We all understand and we all know how much communication can play in terms of shaping our behavior, in terms of generating the demand for the uptake of certain behavior such as vaccination. We call you once again to disseminate the information that we are about to share with you to the general population. You've been doing this thing since the outbreak of coronavirus, and we've gone very far, as Mamandi indicated earlier. We've employed several strategies, including vaccination. We started the giving advice, hand washing to avoid handshaking, using handkerchief or when sneezing or coughing, and avoiding social distance. So those are the measures that we've been employing. But as of now, we want to intensify these efforts. And the only way we can do that is vaccination. Vaccination proved to be very effective. We are seeing a reduction in the hospitalization of our patients. But we are also concerned with the fact that testing is coming down, and we want to encourage the general population to continue to do testing as well as vaccination. EPI will provide you more information on how we are going to conduct this campaign. Of course, the target population is already, they will announce that, and the strategy we are going to employ, because we intend to reach every part of the population so that we can attain the 70% by the end of this year. Once we are there, I'm sure the situation will change. The burden will drastically reduce, because we will have a very good level of immunity for the general population. Thereby, the burden will drastically reduce. So that's what we want. But we are yet to be there. I think this time around we need to sensitize the people and encourage them to come out in large numbers so that we can have a very good coverage, thereby increase our immunity level. So once again, I know you've been doing very well, and we do hope that you'll continue to do more. As I said, we want to thank you very much once again for all the efforts you have been doing since the outbreak of this coronavirus. I know without you, it will be more challenging, because for people to adopt behavior, they need requisite knowledge. And once you are providing that, I think you are also contributing a lot. So we want to thank you once again, and also to add my voice to permanent to welcome you. And from here, we will continue to work with you even in the field. It's not only today. We want you to join you in the field so that people have better understanding. We'll continue to share the information with them and encourage them to come. As I said, this vaccine is very effective and very safe, and we have very good supply of the stock. We have different types. I guess we have 3 types currently, and they are all safe. They all prove to be safe and effective. So once again, thank you very much for your coming over here, and we do hope that this thing will be shared. The information obtained here will be shared. So thank you once again. Thank you very much.
Thank you. Thank you very much, Deputy Director. As he highly highlighted, for the country to have high immunity, we need to vaccinate at least 70% of our population by 31st December 2022. And you've been involved, and we still want you to continue the good work we are doing. We are in it together. On that note, I will allow the program manager, expanded program on immunization, to give a statement. Mr. Sida, you are welcome.
Let me start by thanking all of you, because you have been very formidable partners since we started the fight in this country against COVID-19. So we want to take this opportunity to thank all of you very much for being there for us anytime we need you. You leave all what you are doing, and you come to make sure that whatever we are going to give, you are able to take it to the population. So all of you, we say a big thank to all of you individually. This is a new disease we all know has emerged in the world. There is no way that we are going to control it. The most effective way has been vaccination. Take a shot or 2 of a particular vaccine and you are protected. This way, mankind is able to control disease since the time of those early diseases. So it is important for people to understand that we cannot get rid of this disease without vaccinating about 70 to 80% of the population. That is why partners are there with us. World Bank is here with us. WHO is here with us. UNICEF is here with us. International Organization for Migration, IOM, and government itself, and some individuals are putting a lot of effort to make sure that we also bring our country to the level of those good countries that have reached almost 80. So this is why basically we are all called here. Government has put in a lot of resources and partners. Now it's for all of you and ourselves to come together put this message together and we are able to deliver it to the population, and I think that has been done. We decided to embark on monthly, exercise, 1 week, 10 days. But actually there has been some little concerns. Now we have picked up again. Initially we have problems with our strategy. We expect the population to go to the health facilities and get these vaccines. So that has not been very much effective. So we changed strategies. Instead, now we are going into the communities to bring the vaccine to the doorstep of the population. I think that's a very welcome idea, and we have seen the last round we did that was in May, and we have seen we vaccinated 124,000 in a matter of weeks. So this is what we're going to replicate now from henceforth. So we want you to appeal to the population. We are appealing, and we want you people to take this appeal to them to save this country. We are all complaining of skyrocketing of prices, and everywhere we are told that it's because of COVID. When there's COVID, there's restriction of movement. There's restriction of everything. If you don't have these ships from coming to Europe, if you don't have the other service working, then supply chain will not work, and everything will crash, and we all suffer. That is what is happening. There's no way we are going to solve this without this country vaccinating 70 to 80%. The vaccine is like that. When you vaccinate a lot of people, the disease will come and look for those who are not protected among them, and it has nobody. It just die out like that. But so long they are susceptible who are not vaccinated, it will get them, it kill them, or they recover. And this is what we don't want. Gambia is a small country. We want to remain a viable nation. There are countries here. Just yesterday we've returned from Cape Verde with the minister. Small country, and they are island countries. 78% of the population is vaccinated. So life is going on normally. But actually, if we are not vaccinated, those people are vaccinated, still not the body is going to be with us, even them. So that is a moral obligation for every individual in the world to make sure that you take this vaccine and protect yourself, protect your family. It is important to note that this time around, like the previous round, we are going to vaccinate children from 12 years to 18 years. This is very good. This is remarkable. We know children can be affected like any one of us, but because of their body immunity, the strength of the body's defense mechanism, they don't usually come down with this. They will get it as a common cold. But somebody like me, and I'm sure some of us here, they have either high blood, diabetes, some respiratory problems, cancers. Nobody knows. When they attack these people, normally they will just succumb to death. So that is why it is important to make sure that we vaccinate the population as much as possible. This way, we'll get rid of this disease, and then we move as a country. Vaccinators and canvassers will go around. As I said, they will move from place to place, and the canvassers will go into all the houses and remind them that the vaccinators are there. We are in a weather that is very troublesome. Still, we want to appeal to the population that whenever there are teams in your settlement, please, when the canvassers reach your place, we want to appeal to them to leave whatever they are doing, because this is important. Something you should go and get at the health facility. Maybe you want to pay your fare, $5, $10, $20. Instead, now those people are coming to you. It's just because of government's interest. Government is very ambitious to make sure that we are also apart with the international community, so that we forget about COVID. Because so many very important elders have passed away because of COVID. Colleagues have passed away because of COVID. I mean, I think if there is a means to stop some of this, definitely, I think we should all embrace it. That makes it very, very important. So there's no shortcut. There's no shortcut. We have to vaccinate to protect the nation, or we suffer the consequences. So, and I don't think all of us, we all want to have our grandmamas at home. We want to have our elderly daddies at home, and not just to sit down and all of a sudden. But it has not gone. COVID has not gone. It's going around the world. It's looking for populations that are suboptimally vaccinated and attack them. But where the population is vaccinated, it doesn't have any entry point. The only entry points are those countries where initially we started with a lot of rumors, wild rumors, misinformation, and all those things. But now you don't hear them. Falsehood and truth, they cannot fight. So some people just they confuse people. And those people, after a long time, see, the fact will remain. They don't see it anymore. We have not vaccinated anybody in this country that died as a result of the vaccine. So that is a clear indication that the vaccines are safe. As the traveler has told you, we have 3 vaccines. And the vaccine we have is enough, and we have a lot in the pipeline from the COVAX facility. This is a facility that is set up to help poor countries so that they can able to access it. Because initially there was a scramble. If this organization was not in existence, poor countries, by the time we get it, will be finished. So that organization, no, set up the WHO and Gavi, and then the CEPI, Committee for Epidemic Preparedness Initiative. Those people say we have to come together and help the poor countries so that they have access. Otherwise, this is, we don't know, it started, we don't know how it's going to. You see Italy and all those countries. By the time, before they have vaccines, millions of people. America, how many million people? That is 2 million. Even if, God forbid, we should lose 1 million population, we'll suffer. There will be nobody to run the economy, there will be nobody to run the press, there will be nobody to run the health service. So the ramifications are just too much. So that's why we are always worried. We are always worried when people are not coming. So now we are saying, now we are going to bring the vaccination to your doorstep. I think that is important. And you people have always been suffering. Anytime we call you, come rain, come sunshine, you are always with us. I think we and you people, we understand. We understand now. So I think for us here, I think all of us are vaccinated. I don't think we have anybody here that is not vaccinated. So thank God, that's good. So gradually, but there are still some people that are lagging behind. Yes, they are lagging behind. This is why we want to make sure that we do this round. Every month we want to embark on it. Every month we go for 7 days to make sure that we are able to cover the whole country. So our people are worried. The authorities are worried that the Gambia, the coverage is still not very good. Small country, very, very small country. The population small, the country is small. We cannot allow this country to be rampaged by this disease when we have the weapons to fight it and people are not coming. That is something that is very serious. So I think I may not want to bog you down here. I want to thank all of you very much. This is the simple message. People are coming to every town in this country to vaccinate. Big towns, they've been moving from one location to another. Please, and canvassers will go around to inform the people. Please, we want to save this country. We want to save our elders. We want to save our people who are carrying other diseases. You know, even malaria. Sometimes you may have malaria for quite some time, but once you have another disease like malaria or common cold, that time they break your system and you say, I have this. So but COVID is deadly. It's very deadly. Sometimes it leaves a permanent damage on you. Even if you are a young person, you may have a permanent problem by your chest or whatever. So this is a serious disease. It has not gone. It is going around. We have seen it transforming itself. How many strains do we have now? About 3 or 4. And even this one we are talking about, there are substrains in some South African countries. So the only way we save this thing once and for all is let's vaccinate the population. On that note, I want to thank all of you very much for turning up today magnificently to cover this event so that we are able to take it to the population of the Gambia. Thank you very much on behalf of the Minister, on behalf of the President, on behalf of the Director of Health Services, and on behalf of the Health Promotion Directorate, EPI, all of us, all the health workers. We are ready to serve the population. So let the population be ready to receive us and take this vaccine. Thank you very much.
Thank you very much, Mr. Program Manager. We are being reminded that COVID is still around, and for us to fight COVID-19, we need to be vaccinated. And the ministry has done a great effort in ensuring that services are provided to the doorsteps of the recipients, that's the population. So as colleagues in this crusade, especially the media, we also have a key role. Let's ensure from here the information is sent to the population. Once they receive the right information, rightful decisions and choices will be made to be vaccinated. And we are reminded vaccination campaign starts today till the 20th of May 2022. And even after the vaccination period, this campaign period, vaccines are still available at health facilities across the country, all public health facilities, and individuals can walk into health facilities and receive their vaccination. On that note, I will allow Madam Aja Kande, the communication officer, to give a short presentation on COVID-19 vaccination. We know vaccination started in this country since 10th March 2021 with a grand national launching, and we've vaccinated at least a handful of the population, but still there are challenges. And we want to ensure the population comes out from the 11th to the 20th to receive the vaccine, to enable the Ministry of Health attain its vision of vaccinating the 70% of the population by 31st December 2022. On that note, I allow Madam Kande to lead us into the presentations. Thank you. No, screen all, so we need to. Don't worry.
Thank you very much. I don't know if the mics will be, or I can use this way. Is it okay? All right. Thank you very much, Mamandi. As alluded to by all the speakers here, I want to join them to thank you for coming and welcoming you to the EPI program. As they already highlighted, you are key in our work in terms of spreading the information. And this is why whenever we call, before we start any of our activities, we have a press briefing to send the message outside so that the population gets to know what we are doing. So I will proceed to the presentation. This is just a reminder. This has been some of the messages that we have been reoccurring over and over. And the Ministry of Health, in collaboration with its partners, hereby informs the general public that it will embark on another round of COVID-19 vaccination campaign starting on the 11th, that is today, up to the 20th of August 2022. The campaign is in fulfillment of the government's vision of scaling the vaccination coverage to 70% by the end of this year. This has been already highlighted by Mamanding and other speakers as well. The vaccines that are available, we have the Johnson & Johnson, we have the Pfizer and the Sinopharm. And all of these vaccines have been very effective and safe for the population, because this is not the first time that we are using these vaccines. It is becoming to almost a year that we are using these vaccines, and we have, thank God, that we have not registered any serious effects of the vaccines. So they are very safe and very effective. The target for this population or for this campaign are as low as 12 years, children who are 12 years and above. We used to say 18 years and above, but now the Pfizer came. We are now including children up to the age of 12 years. So from 12 years and above, all individuals who are not vaccinated are eligible for the vaccine. So we can go in for the vaccine. The teams will be using both fixed and outreach strategies, meaning the vaccination teams, there will be some vaccination teams who are at fixed stations, for example, at health facility level or hospital settings, we'll be using fixed strategy. And then we'll be using outreach strategy, meaning they will be going to reach out to communities, either in community bantabas or in other strategic locations, in schools, and wherever they can find the population, they will go into the communities. So the most important thing is the card that we are issuing. Whenever you are vaccinated or wherever you are vaccinated, there is a card that is issued to the person. That is the retention card. And that card is very important for us and for the individual, because the individual who is vaccinated, there is the one, that is the card that you're going to use to tell people that, or to show people that, yes, I am vaccinated. Because there are countries, without the vaccination, you can't be permitted to enter. So without the card, with us here, we would not know whether you are vaccinated or not. But once you have the card, you can go anywhere in the globe or in the world. So I'm encouraging every one of us or the population that anyone who received the vaccine to ask for a card, and the card could be kept for international travel, because we are being disturbed by so many people who come to the office to say, I miss my card, and so and so. So and that card is not into the database yet. The card that we are giving is not entered into the database. What we do is, when you have the card, come to the EPI here, we have the database, because we want to control the database. We don't want everybody to have access to the database. This is why we have just a centralized place to get the database done, to make sure that it is secure. So this is why when we give the card out, the card, you can come to EPI and get the QR code, meaning anywhere you go to the world, that person or anyone can scan the form and know what vaccine you took and where you took it, and what was the dose that you took. So it's important that we keep the card for reference, for us to know that you have taken the vaccine, and for international travel, for you to know, or for the individual at different countries to know that you have taken the vaccine. We have seen, even those to the pilgrimage, those who went for the pilgrimage, they had to come here to get their vaccinations done. If there was no vaccination card, they wouldn't have gone, because there is no way that you can escape without vaccination card. So I'm encouraging every individual to be vaccinated and to have the card kept safe and for international travel, because you may never know. So the vaccination updates, as we know from our database, this is as of Tuesday, the 9th, am I right? The 9th of August 2022. The data is as at 494,512 persons vaccinated. These are the number of doses or number of people who are vaccinated. Out of this, we've seen that the fixed, we've vaccinated 179,923 people, and outreach doses were 314,589 people, meaning people who are going out to reach out to the population vaccinate more than people at the base clinic or at the base site, at the fixed site. So the strategy that we started was not very effective, but we've seen that going to reach out to people is more effective, and we will be continuing with it. So looking at the various regions, we have Western Region 1, a total population of 181,428 people were. But we can go through the different regions. We have Western 2, we have URR, we have CRR, we have LRR, North Bank Region West, that is SL and the other part of North Bank West. We have North Bank East, that is Farafenni and beyond. So we have seen the performance of each and every region. But these are just numbers that we think they are many. But if you compare them with the total population, it's a bit low, because we are not even up to 500,000 people. If you look at the total figure here, we have 494,000, which is less than 500,000 people. It's just not even up to quarter, close to a quarter of the population, or maybe, yes, quarter of the Gambian population. We will come to see the national coverage. Vaccination coverage stands at 18.5%, and we are saying by December we are expected to reach 70%. What are we going to do, or what are we expected to do to reach 70% at this just few months before December? So we have a long way to go. And looking at individual doses, we have people who took at least one dose. Almost 52,241 people. You can see in blue, in light blue. In dark blue are people who took at least 2 doses, meaning people who took the 2 doses. They are up to 32,448. And if you look at those who took the booster doses, we are encouraging the elderly and those people who are with condition to go in for the booster. And the booster, we only had 9,823 people. So if you cumulate all these figures, we are at 18.5%, and we are supposed to reach 70%. Just the gap is just too wide. So we need a concerted effort, and we need extra more efforts to see that the population reach vaccinated. We reach the 70%. So looking at the vaccinations by category or by group, we said 18 people or 18 to 40 years old. We have a vast number, and we have the categories as listed: 41 to 64 years. We have 12 to 17 years. We have more than 65 years old. We have people with preconditions like diabetes, hypertension, and so on. We have community workers. We have health workers. We also have teachers, security, and hoteliers. So I think with the category, we could see how people are vaccinated. But nonetheless, we may have our own different diversions. For example, a health worker will register as a community worker, or will register as under 18 or above 18. We have sort of those things. Perhaps it may not be the reality of what we are presenting, but this is what we saw in our dashboard, and this is what we asked for. Sometimes some people may not want to disclose their profession or whatever, but we believe that there are people we still need to follow who needs to be vaccinated, and it doesn't matter which group they belong to. It doesn't matter. But what matters is if they are eligible, meaning they should be 12 years and above, and they need to be vaccinated. So let's all clear their doubts, if they have any doubt, to make sure that they know the facts about vaccination or about the COVID vaccine. And if they are enlightened, probably they may come for the services. The services are readily available. They are at health facility, although we are having a strengthened immunization, meaning a round, meaning we just want to make it at an intensive phase in these 10 days, but it continues. It is available in all public health facilities that are conducting EPI services, meaning they are conducting the nurse services as in our local language. So communication and social mobilization, we have done a lot together with you people. We have done a lot. We have gone to radios, we have gone to TVs, and this could have not been done without your support. And we have conducted so many media briefings and so many media engagements in terms of selling out the COVID vaccination. But yet, we don't have to be reluctant or we don't have to be discouraged. We still want to encourage every one of you to continue the efforts. Perhaps one day or the other, we will be able to come up with good coverages. And we'll be able to convince the population. You could see the series of, and this is just a limited number. We have done beyond this, but this is just some few chosen activities. That is the TV, the caravan, the message have been developed, the press releases, the press conferences or press briefings, vaccination of the Q group that was aired, and we also have borderline communities vaccinated, that is the IOM, we call the citizen engagement. We also have ongoing community engagement with the local authorities and the local, local people like the religious leaders, the traditional leaders, the traditional healers, and so many other things, the drama groups and so many other groups that we've orientated. The Red Cross volunteers have been also engaged, and they are going on a monthly sensitization to communities. That is also ongoing. They have the orientation of school authorities, PTAs, that is the Parent-Teacher Association, the school management committees, student rep, and every other part of the school authority that we are using, or structure that we are using. So we have done a lot of sensitization, but still, although there are improvements, but we still want to encourage everyone to continue the bit of communication or sensitization so that the masses will be able to be enlightened. So the role of the media personnel, we know. We are just reminding you. We know that you know your roles and you are playing your roles, but we want you to also be reminded of the roles that you are expected to play. You start with yourself first. Make a choice and go for the vaccination. You have to be vaccinated. You have to be convinced first that the vaccines are safe and effective, so you will be able to convince others. If not, you may not be able to convince others if you are not convinced as a person. So I will start with you to be convinced first before you convince others. So you make a choice and be vaccinated first before you talk to others. So sensitize the public on the importance of COVID-19 and other preventable diseases. Vaccine preventable diseases are so many, and we have them in our systems. We have the usual routine vaccination or immunization clinics that we call in our local language NOS. We all know, both male and female, we know the NOS. They are giving out vaccines to children to protect them against vaccine preventable diseases like polio, like measles, like yellow fever, hepatitis, and you name them. There are up to 13 vaccines or 13 antigens that are given in this country, and they are all free of charge. So as COVID as well. COVID is also free of charge. So I think the population should trust that we have been giving vaccines to children under 5 from 1979 to date, and it's the same program that is giving out the COVID vaccine. So the trust should be there, and it is available in all public health facilities. So you are also expected to disseminate the COVID messages, be it preventive, be it vaccination or testing and so on. We are expected to talk about the COVID in our talk shows, either radio or TV or online, whatever platform we have. We are also reminding you that you encourage the public to go in for the vaccination, as it's the lasting solution. We are also reminding you that you mobilize parents to vaccinate their children. You, as perhaps some of you are parents already, you can mobilize your fellow parents or perhaps your neighbors or your close relatives to talk to their children who are 12 years and above to go in for the vaccine and be vaccinated to prevent them against prevent them from the COVID and protect their others beside them. So you refer the public also, or public concern, to the nearest health facility. If you know you cannot answer the question, perhaps it is too technical for you. We know we have technicalities in some of the questions that some of the population may come up. You can refer them to the public health facilities, or you can refer them to the nearest health facility, and also use the 1025. Tell them to dial 1025. Perhaps they will have somebody to respond to their question or needs. Inform communities and households of the vaccination days. We are reminding you to sell out the dates that we are giving for the vaccination campaign. That is from the 11th to the 20th of August 2022. So with or without, how do we call it? The dates, the COVID vaccination still continues. Without the campaign, the COVID vaccination still continues. So we are employing on everyone to tap on the opportunity. As in this round, we will be reaching every community center so that we will also have people at their doorsteps. But after the round, you will have to go to a nearest health facility. That may even cost you $10 or $20 to get to that health facility. So to avoid that, we are reaching to you, so you make a choice and be vaccinated. The challenges that we are facing currently are pockets of hesitancy, meaning people are just hesitant to get the vaccine. Perhaps they do not have the correct or the facts about the vaccine, but if you talk to them about the vaccine, some may be convinced along the line. And this does not apply to only the COVID vaccine. It applies to COVID, it applies to the routine vaccine, including HPV. And we know HPV is also another disease that is also killing some of our population or our members. And we have a vaccine for it. It's a vaccine preventable disease. We can prevent it. So why do we allow our people or our relatives to die of disease that we can prevent? So we need to encourage them to come up and make a choice and be vaccinated. We also have misinformation. There are people going around either on the social media or even within our communities talking about rumors about the vaccine, which is not, most of the time not true, but we still hear them. But if we have those types of rumors, as journalists or as health health oriented in terms of the COVID, you can counter them. You can come and say, no, this is not the truth. We talk about the facts, and they will be able to be convinced, because I'm sure some of them are saying it is because they don't know. So these are the ways forward. Increase awareness. Generally, we want you to help us to increase awareness of COVID in our population or among our population, and thereby increase uptake of COVID-19 vaccination. If there is enlightenment, we believe that people will come out for the vaccination. And we also implore on you to debunk or to counter the rumors and misinformation through fact sharing. We know we already have the facts about vaccines, their safety, how do we take them, and we have enough of the vaccine. We have also trained health personnel who are trained purposely to deliver the vaccines. So we don't have any problem in terms of vaccination. So the problem is for people to accept and take the vaccines. And I think with that, that's the end of the presentation. I would like to thank every one of you. Thank you.
Thank you very much, Madam Kande, for a brilliant presentation. I think we have more detailed information on COVID-19 vaccination and the status of vaccination in the Gambia. As she said, we are not safe until we are all safe, isn't it? So all vaccines available in country are safe and effective against COVID-19. And we know, as data have shown, we've seen a quite number of people that received the first dose and some are still yet to receive their second dose. So we encourage the population, especially those who receive their first dose and needs to receive their second dose, let them use this opportunity and get their second doses of COVID-19 vaccine. To the school students, we know the last round especially, those age 12 were found in schools, and we know we are on holidays, but parents should encourage their children to be vaccinated from the 11th to the 20th. On that note, I will allow for a question and answer session, if any, and we'll take by 3-3. Do we have questions? See that? Just read that. And thank you very much. Do we have concerns? Yes. Yeah, please, if you do, raise your hand. Yes. And
my name is 𝒕𝒉𝒊𝒔 from Ghana.
Binta.
Yes.
Okay.
There have been rumors going around that some students were given the Johnson and the Johnson.
Rumors?
Under the age of 12. Sorry, those who are 12 above.
Students, yes.
Being administered with the Johnson and the Johnson.
Okay.
I don't know how to explain. And if it is true, is it acceptable or is it required for them to take the Johnson and Johnson instead of the Pfizer?
Okay. We'll take 3, then answer. Any other person?
Yeah, Mustafa is here.
Mustafa.
Yes.
Yes, my name is Mustafa. I work for 𝒂𝒄𝒄𝒏. So I'll direct my question to the EPI program manager.
Okay.
Yes, I'm one of the people who have done the documentary for the Ministry of Health in terms of COVID uptake in the Western Full Health region.
Okay.
I'm glad that you mentioned that there is a pocket of COVID vaccine hesitancy that exists. This is something that still exists. I tried in my best. So as my colleagues, and I have to acknowledge the effort put by Aminata, the communications officer at the EPI Western region. But we still have some people, a reasonable number of people, some of them are very influential, who are still bent on the disinformation. I will not call it disinformation. The disinformation prepared by certain folk abroad, sent on them via social media, and consumed by them, that they are not taking this vaccine. I think it is important for the program manager to re-echo government's plea before the media here. So, because this is something, the more you talk about something in the government, the more it is important, So it's important for him to come back, sit in a serious note, mention some of the misconceptions that are attached to this, debunk them, and also encourage mass vaccine uptake for us to reach the 70%. Because if I am safe, he is safe, and there are a lot of people out there are not safe. We're still not safe. So this is my concern. I don't know if program manager.
He will. Yeah. Any other person?
Yes, I have a second one.
Okay.
That is in the Aja's presentation. She said that initially the threshold for the vaccination is 18 years. So she said with the advent of the visa, it has now been reduced to 12 years. So does that mean that it's only the visa that should be administered to those for those 12 years, or all vaccines are now going to be administered?
Okay. So to start with, I'll start with the last question. You know, when it comes to vaccination, like any other medication, you have prescribed ages for each vaccine. When we started vaccination in this country, we started with AstraZeneca, and it was given to 18 years and above. Less than 18, you are not encouraged to take. So we had J&J. It was also 18 and above. We have the Sinopharm. also 18 and above. Then we had Pfizer vaccine. And when Pfizer vaccine came, Pfizer is recommending from 12 years and above. The lower limit is 12, and the upper limit can go up to 100, up to the last number. So for Pfizer, it's recommended for age 12 and above. So if you are within 12, 13, 14, you can receive Pfizer. But if you are 18 and above, you can receive any of the vaccines available. Do we understand? These are simply because the studies are conducted on those age cohort, and the manufacturers are recommending it should be used on them for efficacy. We know we are vaccinating for a purpose. So if you want to achieve the purpose, you have to give it to those who need the vaccine. So taking the vaccine like Pfizer at 12, we believe is a safe vaccine and a vaccine that is effective for those ages 12 and above. Is that clear? So it's based on the vaccine. So the other vaccine, my colleagues are here, they will add. The other vaccine is J&J given to students. It's not to our notice yet. We've not received any complaint in that regard. We are not saying it's not happening, but we've not received any communication to that. But this shows that we are partners. As you give information to the population, you also give us information so that we can put in corrective measures. You understand? We know anyone given vaccine are qualified and trained, but we also know human errors can happen. You understand? But with this, we'll also intensify our training and communication to the population. Though we've not received any report from either a parent or a child or a school authority or from even health workers that we've received this vaccine or we've given this vaccine to a particular child. But this is also a lesson learned that we will also intensify the training and communication on our health workers. Huh? Good. The other one, the program manager will surely give a statement to the population to that effect. Huh? Yes. Any other vaccine?
In addition, the students, I don't know, I say the students, still with the mature students.
Yeah, yeah.
If it's a mature student, it's not a problem.
I mean,
Somebody above.
under 18. 12 years. I saw the card.
You saw the card.
Yes.
And sometimes too, maybe the one recording made a mistake. You know, the vaccinator will vaccinate. As we said, we have a composition of 3 personnel to a team. You have a recorder, you have a canvasser, the one that we expect to go around within the neighbor and telling them that the vaccine is here, is for these people, and we also have the vaccinator. Maybe the vaccinator might even give the right vaccine, but the one vaccinating, because we have choices. Huh? But as I highlighted, it's a point noted with all seriousness, and we'll also intensify our training, and we'll also work with the health workers to ensure if such is happening, it will be addressed.
Just a quick one. Yeah. If you are administering this vaccine to students in schools, is it possible to put their parents in the picture, or you just give it to students?
No, usually what we do, you know, school and students have a valuable time. That's the contact time. And if every parent wants to come to the school to be present for the child, it might be chaotic a bit, and that valuable time might be lost. So what we will always do is we work with Ministry of Education, and we believe parents have that trust in teachers, that they allow teachers to handle their children from 8 to 2 o'clock or from 8 to 4 o'clock, and they can take care of their children. So we will always communicate with Ministry of Education. We work with them to ensure we deliver our services. Schools, we know schools are one of the most convenient places that we can vaccinate. And this is why always we go into social media we go to television, we do community engagement, so that parents at home will be aware and will know that such and such activities are currently happening in schools. So if your child should come and tell you, Mom, today I received COVID vaccine in school, we know already you might have had the information either from a newspaper, social media, or even on QTV, GRTS, or from your village imam or village alkari, because all these people are engaged. This is why we use schools, huh? And I hope I've addressed.
Some parents were complaining that their kids were administered with the vaccine without their knowledge.
Yeah, you know, sometimes we also have a culture that you will use your mobile, TikTok and other things, but news you will not listen. When they call for a village meeting, you will not. We feel too busy. Even sometimes we will go up to school to call for a PTA meeting so that we'll discuss with parents before the event. But if you are a parent like me that is too busy to go to the school for such meetings, obviously you might not. But it has not been our intention to disregard whatever they thought, but we just want to save that child and save the future of this country, because we know those 12 years will one day come and replace me, will take your position and even take the position of the health minister. So if they are safe, healthy, we are hopeful the future will be bright for this country. That's our aim, huh?
Yeah, maybe we can add, like, we understand, like, some schools don't belong to the Minister of Health. They are private schools.
Yes.
Like, in that case, the team will even engage the school for them to either go in for consent from the caregivers. We even go up to that level. So, because for this, we want people to understand, everybody to understand that what we are doing is for the interest of the country. So that's why we want to be cooperative, and we want everybody to understand what we are trying to do. So for the private schools, yes, we even go to extra miles to engage the authorities, or even to involve the parents and caregivers.
Sure.
To add on that, the task force here, Central has education. They work closely with every cluster monitor of this country. Our regional offices will work with those in Burkina, Tanzania, Parapenya, and all those places. Secondly, about this vaccine, there are vaccines in the pipeline that are going to be even for 5 years. But this is a problem now. We are in it. We don't know how it will end. The most cost-effective public administration is for an individual to take the vaccine. So very soon we are going to receive that post. It's in the pipeline. So it's an emergency. That's why all these vaccines are given emergency listing, and they just want us to understand it like that. We are working with partners, many partners. And what you said is very important. I think some people are just difficult, not just difficult like that.
No, after you will have, you will have. Once we are done, he will give a statement to that effect.
I'm available.
Any other concern? Are we cleared? We know you are all professionals, huh? Yeah, and on that note, I will seize this opportunity on behalf of the Deputy Program Manager, Deputy Director, Directorate of Health Promotion and Education, our able program managers, my colleagues, to thank you for your coming. It is a partnership, and we have been in this since when COVID started in this country. And we hope our relationship will be more and more tighter. We all have an ultimate objective, that's to provide the population of the Gambia our best services. Whether you are a journalist, whether you are a nurse, whether you are a politician, what we yearn is to provide the best services to our population. Your coming is a sign that the health of this country is our priority, and we hope the information about this forthcoming campaign will be seen all over the media platforms. And even beyond, we have our schoolmate pages, we have our relative pages. Please, let's extend the info to anywhere possible, so that the entire population of the Gambia will be aware of this campaign, and it will be a great pleasure for the ministry to achieve its vision come December 31st. That is, we want the 70%. You know, there's a big gap from 18 to 70. So we all need to put in our effort to ensure this vision is achieved, and we'll all be celebrated, and history will remember all of us to that effect. Thank you very much. Sit down.